So, good morning, everybody, and welcome to today's Let's Talk About session, where we will be talking about hearing loss and aging with Marta from the Canadian Hard of Hearing Association of Newfoundland and Labrador. Before I hand it over to her, I just have a few housekeeping things for us to go over, and then we will get started. So again, just a few housekeeping things. So before we get started, I do ask that everybody mutes their mic just to block any outside noise that might be going on kind of in your home or wherever you are. If you need captioning, there's a button at the bottom of the screen to access that. And we also have our interpreters here today as well, Shelby and Jordan. So if you need to pin one of them as well, you can click on the button kind of in the corner by their screen and it will pin them for you as well so that you can see them. If you have any questions or comments, you can go ahead and put those in the chat, and we'll have some time at the end to discuss those. And just so everybody knows, the session is being recorded, and the session will also be posted on YouTube for anybody that's not able to make it today. We also wanted to do a land acknowledgement before we get started. So we have Barb Benson, who works in program support here at CHHA-NL, who's going to run through that with us today. So if Barb, you want to go ahead and do that.
Okay, good morning. My video's not working, so sorry about that. We respectfully acknowledge that the lands on which we live, work, and meet are situated on the traditional territories of the indigenous groups of Newfoundland and Labrador. And we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and the Inuit of this province. We honor the diverse indigenous peoples who have cared for this land for past generations and for the 7 generations to come. We are committed to listening, learning, and working in collaboration with indigenous communities as we move towards reconciliation, respect, and mutual understanding. Let us carry this acknowledgement forward in our work and relationships as we strive to create a future that respects and embraces the wisdom of older adults and the diversity of all communities.
Perfect. Thank you so much, Barb.
You're welcome.
Oh, let's see here. Oh, there we go. Okay, so a little bit about our speaker for today, just before I hand it on over. So Marta is the coordinator of education at the Canadian Hard of Hearing Association, NL. She holds an undergraduate degree in psychology and a graduate degree in educational psychology and education for the deaf and hard of hearing. She is also a certified occupational hearing conservationist. In her role at CHHA-NL, Marta focuses on public education, outreach, accessibility, and collaboration with community partners to promote hearing health and awareness. She is passionate about empowering individuals with hearing loss and advocating for inclusive, accessible environments, and we are very happy to have her here today. So with that, I will go ahead and hand it on over to her.
Hello, everybody, and thank you, Courtney, for your kind introduction. I will share my screen now to make sure you can all see my presentation, and let me know if you do. So it is on a second screen, so I might be looking off camera for a little while, but I'm not ignoring you. I'm just looking at my presentation. So today we will be talking about hearing loss and aging and why hearing health is important. As Courtney said, my name is Marta Evstigneev, and I am coordinator of education with the Canadian Hard of Hearing Association, Newfoundland and Labrador. And I'll just have a little bit to say about who we are. CHHA-NL, as we lovingly call ourselves, are the only organization in Newfoundland and Labrador committed to supporting individuals of all ages with hearing loss through education, awareness, and communication programs. And most of the funding for our organization comes from our own supporting community lotteries that include Ultimate Dream Home Lottery and 50/50 Lottery. So if you've ever bought those tickets, you are supporting our work. And thank you very much. So I'm going to start with what the hearing loss is. And it is defined, a person with hearing loss is defined as somebody who's not able to hear as well as somebody with normal hearing, which is pretty obvious. And that is defined as having hearing thresholds of 25 decibel or better in both ears. which means probably nothing to you if you're not a sound scientist or audiologist or work with hearing. So 25 decibel, we say if you can hear a person across the room whispering to you, that is about 25 decibel, which is not how we measure hearing. This is not the hearing assessment, but that gives you a little bit of an idea. But of course, hearing loss varies greatly, and there are different levels that range from normal through mild, moderate, moderately severe, severe to profound. And this can happen in one or both ears. So this is a question, we're not going to have a public discussion, but just for yourself, why do you think our hearing is important? I do that presentation a lot with seniors all over the province, and usually people say, you know, communication is the main thing, because we do use language and speech and hearing, of course, for communication. Most of us do. And hearing affects our ability to communicate unless people use sign language, which is a different form of communication. Most of us do use hearing in communication, but it's not the only reason, right? We also use our hearing to orient ourselves in the world, for safety, for enjoyment, and so on. So hearing does play a pretty big role in our life. This is a dry part, but it is important and it can be profound. So there's some hearing loss statistics in Canada. And Statistics Canada tells us that about 54% of Canadians between the ages of 40 to 79 have at least mild hearing loss. So that's over half of people over 40 years old have some form of hearing loss. But the more important part is 77% of those people with hearing loss don't know they have hearing loss. And even when they do, the average person waits about 7 to 10 years to do something about their hearing, to treat it in some way. So a lot of people are pretty surprised at those statistics, and it does reset your understanding of people around you, especially if you work with the public, if you work with people, and especially if you work with the aging population, with the seniors, those numbers are even higher. So just assume every second or third person you're talking to, if they're a senior, has hearing loss. And from that, again, the reflection question, do you have hearing loss? And if you think you don't, how do you know? Unless you had a hearing check recently, there is no way you can know for sure. So something to ruminate on. So hearing challenges are very often overlooked because they're invisible. They're invisible to others, so people don't know you have hearing loss unless you have visible hearing aids or cochlear implant or something like this. But it's also invisible to us. We are very poor judges of our own hearing because we don't know what we're missing when we're missing it. And it's actually very common for people around you to notice your hearing loss before you do. So people like your spouse or your children or your friends would say, something's not right. You should probably have it checked out. And if somebody says it to you, you should probably do something about it. So now I'm going to talk a little bit about hearing and how it works. I promise to go through it quickly, not to bore you to death. So you see here the, so to say, hearing system, right? The ear, all parts of the ear. But we actually hear with our brain, not with our ears. Ear is just a tool to get the sound where it needs to go, which is in your brain. So the outside of your ear is called pinna, and this, along with an ear canal and ending with the eardrum, is the outer ear. Then it goes into the part that's called a middle ear that has three little tiny bones called stapes, malleus, and incus. They vibrate and then they connect to the inner ear through the oval window. And the main part of the inner ear responsible for hearing is the cochlea. It's shaped like a little snail, and it has little cells that are called hair cells, and they move in the liquid when the sound goes through. And from there, the sound impulses, they get converted into the electrical signal, and it goes into the auditory nerve, and it goes to your brain. So the reason I'm talking about it is if you kind of have a basic understanding of how the ear is working, any part of that, if there is a break in any part of that system, you might have hearing loss. In outer ear, in middle ear, in inner ear, if something is not working, the system is very fragile. So any part of that, if it's affected, can lead to hearing loss. And depending on where that break occurs, there are different types of hearing loss. So usually they're divided in three big groups. So there is a conductive hearing loss when the problem is in the outer or middle ear. So it can be fluid buildup in the middle ear. So usually middle ear infection. Sometimes little kids get that, and they even get little tubes sometimes for drainage. So that fluid buildup can cause hearing loss. Foreign objects is another one. So most of us probably have heard that we shouldn't stick anything in our ears, not even to clean them. So Q-tips and stuff like this. But again, little kids love to do that. And I tell the story often that my sister, when she was little, she broke a crayon in her ear. And it was flesh colored. So we had no idea there was anything in her ear because she stuck it nice and deep into her ear and broke it there. And she was effectively deaf in that ear for a while, and my mom was pretty concerned, but then she took her to a doctor, the ear got syringed, and her hearing got magically restored. So that happens as well. Allergies can cause hearing loss as well. So the swelling of the tissue due to allergy can block your ear canal and cause some hearing loss. Ruptured eardrum or impacted earwax, those are all things that cause the conductive hearing loss because, as I said, they happen in the outer or middle ear. And that's not an extensive list, but just to give you an idea. And as you can tell, some of those things can be helped. So there are some things doctors or even you yourself can do, or sometimes just the time and medication can help with some forms of conductive hearing loss. So, if you have an allergy, you take allergy medication, your swelling goes down, your hearing gets better. If you stick a crayon in your ear, and it gets flushed out, then you can hear better again, and so on. Not everything, like a ruptured eardrum, you cannot take a pill for that. So if it's damaged, it's damaged, but some conductive problems can be helped medically. Now, if your problem is in the inner ear or with the auditory nerve or with the brain part that is responsible for hearing, we call this sensory neural hearing loss. And those things are permanent. So once sensory neural hearing loss happens, there is no going back from that. And hearing loss due to aging falls under that category. So that is the problem in your inner ear, in the cochlea, those little hair cells that I talked about. They get damaged with age and with noise exposure, and you cannot really restore them. So we have to take care of our hearing and try and not make it worse. So aging, noise damage, as I said, some drugs cause damage to our inner ear, auditory tumors, and of course, blasts, explosions, and really loud noises. They all cause sensory neural hearing loss. And as I said, it's permanent. And sometimes in some very unfortunate situations, like with genetic disorders, infections, and some head trauma, people can have both sensory neural and conductive hearing loss, and it's called mixed hearing loss. So another thing I wanted to talk about is what effectively it is like to have hearing loss. What does it sound like? What do people hear when they have hearing loss? And that's, of course, very different for different people. And it depends on different factors like what hearing loss type they have, like I said just now, conductive or sensory neural or mixed, hearing level. Of course, somebody with mild hearing loss and somebody with profound hearing loss will have a very different auditory experience. Environment is a big one, and people underestimate it. So if you're in a quiet room, one-on-one with a person, talking at a normal speaking level, and if you are in a big group of people in a noisy restaurant, of course, your hearing will be very different in those different situations. Distance, it's much easier to hear somebody who's right next to you than somebody who's trying to talk to you from 3 floors up or from across a football field. And things even like personality, mood, and your attitude can affect how you hear, right? Or if you're sick and have a fever, that might affect how well you can hear. So there are many different factors. But for all intents and purposes, I have a little demonstration to show you what a person with mild hearing loss might hear. And it's called an unfair hearing test. Don't worry, there is no test. I'm not giving out the grades. It's just, as I said, a demonstration. So what's going to happen, I'm going to play a sound clip now in a second. And it is a recording, a very old one. So it's from, I believe it was recorded in 1950s. But it is still very valid, and it's a really good demonstration that shows people what it's like to have hearing loss. And if you can't hear those words clearly, please don't be alarmed. That's the whole point. It just gives you the idea of what people with hearing loss might hear.
Number 1, fill. Number 2, catch. Number 3, thumb. Number 4, heat. Number 5, rise. Number 6, wedge. Number 7, fish. Number 8, shows. Number 9, bed. Number 10, juice.
So how was that? Usually when I do this in person, people look pretty shocked because it's loud enough. You can hear a person talking. You probably can understand number 1 and number 2 and so on pretty easily because you can have context. After number 1 comes number 2, number 3, and so on. But the words they're saying are not clear. A person is saying words. You might even be able to guess what it could be with not very high level of certainty. But, so this is what they did. They removed the high-pitched sounds, which is what we usually deal with aging. It's the high frequency that we're losing first. So we can hear the low-pitched sounds, but high frequencies are gone. And it makes speech very muffled and very unclear. So a lot of the time, people who are older, they say, oh, it's not my problem. I can hear. It's just they're mumbling. They need to speak up and speak clearly. That's why I don't understand what they're saying. So just for your information, those were the words that were spoken. but a lot of the time it's really hard to understand what exactly is being said. So this should give you a little bit of an idea when you're communicating with somebody who has hearing loss. This is what it is. It's not like a volume button or a volume dial on the radio, right? It's not just about the volume, because that's what people think a lot of the time. It's mild hearing loss means it's a little bit quieter, and then it's quieter still, and so on until you turn the dial all the way to 0. That's not what it's like. A lot of the time people do hear the speech, they just can't understand it. So, and it's important to know. That's also why it's hard to recognize hearing loss in yourself, because it's not just all quiet, right? It's unclear, and it goes gradually. So now I want to talk about what you might see in somebody who has hearing loss and how it presents itself. So what are some of the signs that somebody might have hearing loss? And here they are. So one of the first ones is difficulty following along with a conversation, especially when there are multiple people talking. If you can see that somebody has trouble following who said what and how it all goes together, that might be a sign of hearing loss. Complaining that everyone is mumbling, as I just said, right? Speech sounds very unclear. So a lot of the time the blame is laid on the other conversation partner. Turning somebody's head towards the sound, it's almost like a tennis match, and they're just looking, what they're actually doing is looking at a speaker's face. So trying to have that speech reading, lip reading, to help them understand what is being said. Difficulty hearing certain sounds. So some sounds might be very audible and some might not be. And one of those sounds, for example, is the fire alarm. So because the fire alarms are pretty high pitched, so people with significant hearing loss a lot of the time cannot hear the fire alarm, which is a big concern. So we actually have a program to help with that. So if it is you, please reach out. I'll share our contact information later to see what we can do for you. But yes, the fire alarms, and people don't believe me sometimes when I say, people can have a conversation, but they can't hear the fire alarm because those dang things are loud. But if you don't have that high pitch register available to you, you can't hear it. Playing things at loud volume, right? So some people have TV on bust and people around them are complaining, but that's what they need to do to hear the TV. And it is definitely a sign of hearing loss. Sometimes people bluff or respond to your request or a question inappropriately. So you ask one thing and they answer something totally different. And it's because, you can only ask people to repeat themselves or rephrase it so many times. And then people just think, oh, whatever, I'll just take a guess at what I need to say because it's just embarrassing. People asking others to repeat themselves, right? And also having difficulty hearing at a distance. Like if you're talking to somebody from another room and they can't see you and they can't hear what you're saying, that could be a sign of hearing loss as well. So, we did talk about communication, but, and of course that suffers when you can't hear well. But what other risks are we facing with hearing loss? And those risks are very significant. And one of the most profound ones is cognitive decline or dementia. In people with hearing loss, the odds of getting those cognitive problems are dramatically increased. Hypertension is another one, which is not very obvious, but high blood pressure is shown to be more common in people with hearing loss. Depression, that kind of makes a little more sense because if you're isolated from people and can't communicate effectively, that can cause mental health issues. Difficulties with mobility and balance. is another risk, and it is well documented that people with hearing loss are much more prone to falling and hurting themselves than people with normal hearing or people with treated hearing loss, and social isolation. So I did mention cognitive decline, and I did want to talk about it in a little bit more detail because it is a serious side effect of hearing loss. We actually collaborate with a science research group from MUN, and they will be doing a webinar with us during May months, which is speech and hearing months. And they will be talking about their research and the scientific link between hearing loss and dementia and cognitive decline. So it is a serious risk, and we try and let people know, because like I said, a lot of people have hearing loss, but even more people have hearing loss and don't know about it. So the longer you wait to treat it, the longer you wait to do something about it, the higher your risk of developing those cognitive issues is. So even mild hearing loss, they tell us, can double the risk of developing dementia compared to somebody with normal hearing or somebody who has hearing loss treated. So somebody who wears hearing aids, right? So this is something to know and something to think about. And of course, mental health is a very serious side effect as well. And as we all know, mental health affects our physical health. So it is another very serious side effect of hearing loss. And it is, again, scientifically proven that people who have untreated hearing loss are more likely to have emotional and mental health issues. Because of this disconnect from others. People withdraw from social gatherings, from communicating with their loved ones, and it does have a toll on their mental health. And it leads to them feeling lonely and emotionally isolated. So there is something we are trying to do to mitigate those risks. And one of those things is our hearing screening program. So here at the Canadian Hard of Hearing Association, in our office, which is on Topsail Road in Mount Pearl, we have hearing screenings, free hearing screenings every Tuesday. So you can go on our website, make an appointment, or give us a call and have your hearing screened. Now, it's not a full hearing assessment. We're not audiologists, so we are not going to give you an audiogram and tell you exactly what your hearing is like. But what we do is screen to see if your hearing is normal or if there is a concern and you should have it checked out. So it is a program we developed to help people understand the importance of hearing health and treating hearing loss. We're trying to reduce that time. People don't wait 7 to 10 years. So early identification and treatment is very important. And we are trying to let people know how important it is to treat their hearing loss, right? Not just to know you have it. So we also talk in detail about realistic expectations of treatment and different treatment options. And we're trying to improve the trust of hearing care professionals. A lot of the time, people have a lot of skepticism, and they think, oh, if I go to a private clinic, they're going to upsell me and sell me something I don't need, and it's expensive, and they're just after my money. A lot of the time, or I would say almost all of the time, this is not true, and people are trying to help you. But it is, it is important technology and so on, and we'll tell you about it and help you understand what it is, how to use it, and what to expect from it. And everybody who goes through our hearing screening receives a hearing care package. So it's a lot of information and reading materials and so on. Everything you would need to know to treat your hearing loss if you do have it. So now I want to talk about what we can do or what can help your hearing loss if you do have it. And there are multiple options and there are a lot of things you can do. So amplification technology is one thing. That's the technology you would wear that helps you hear. Hearing assistive technology is everything else. So like amplified telephones, communication devices and so on, speech to text apps. And I'll talk a little bit about that as well. Simple things like communication strategies and just knowing, how to communicate effectively can be very helpful as well. And of course, hearing care professionals like myself, audiologists, and other people who work with hearing loss, that is also a helpful and useful resource. So let's start with amplification technology. So the most common one is hearing aids, of course, and that's where people usually start. And there are many, many different types of hearing aids. And it's used for all levels of hearing loss and also all types of hearing loss, so conductive and sensory neural hearing loss, depending on what it is. Hearing aids would be the first thing people try. Now, there is a thing called bone-anchored hearing aids, or BAHA. So that is usually used for people with conductive hearing loss. So when your inner ear and your auditory nerve and your brain work normally, but there is a problem in the outer or middle ear, your bone actually conducts sound as well. So a bone-anchored hearing aid is used in those circumstances. It's not as common as a regular hearing aid, but you might see those as well. And when the problem is either in the middle ear or in the inner ear, there are also things known as middle ear and cochlear implants. So when hearing aids are not an option due to different reasons, or the hearing loss is severe to profound, middle ear and cochlear implants can help in those situations. So this is a little slide just to show all different types of hearing aids. And nowadays, hearing aids came a very, very long way from when they were first introduced. And it was a huge cumbersome device people had to wear somewhere on the belt or around their neck. And it came with like headphones or something like this. And they didn't work particularly well. So nowadays, hearing aids are tiny and very, very smart. So a lot of them are rechargeable. There are all different sizes. Some of them are invisible in the canal. You can't even tell somebody's wearing a hearing aid. Some are still a little bigger, go around your ear, but compared to what they used to be, even the biggest hearing aids of today are pretty darn small and pretty much almost invisible. And they can do a lot for you. So a lot of them now are very smart. It's pretty much a small little tiny computer that you wear around your ear. And it is programmed specifically for your hearing loss. A lot of them are rechargeable and they have Bluetooth technology. So they can connect to your phone and you can adjust the volume. You can adjust different settings for example, to hear a noise and so on. A lot of them come with accessories for listening to your TV, for example. It can connect directly to your TV so you can listen in your hearing aids and so on. So the technology has come a really long way and is really smart and incredible. So with all that we talked about, with all the health risks, and with how much hearing aids can be helpful, why do some people still hesitate to get at them? And of course, it's not a simple question because there are multiple reasons for that. And one of them, and the biggest obstacle to getting hearing aids is, of course, the financial problem, right? So they are really expensive. And people hesitate to get them just because it's a lot of money. And there are several programs that can help fund hearing aids. So one of the biggest ones is the Provincial Hearing Aid Program, or PHAP. And this program is offered by the provincial government of Newfoundland and Labrador, and it pays fully for hearing aids for people on lower income. Now, government's definition of low income is very strict. It is changing, and there are a lot of advocacy efforts from us, from audiology department and other people and organizations to lower those criteria and to have more people being able to avail of the provincial hearing aid program. And it is getting better. I'm not going to go into too much detail about it, but if you're interested to know more, please reach out to us and we can talk to you about it. So if people are working and have private medical insurance, it covers some of the cost. Doesn't cover all the cost, but there is an allowance, annual allowance under most benefit packages for hearing care. Now, CHHA-NL has a program for people whose hearing got damaged in the line of work. So if it is due to noise exposure or to an accident at work or something like this, CHHA-NL through workers' comp program, they pay for hearing aids. So Health Canada has a program for Indigenous populations. They pay for their hearing care. And Veterans Affairs has a program for people who are veterans, who used to be in the military, in the Navy, or something like this. So there are some programs that can be helpful. I want to talk a little bit about the expectations people have of hearing aids and the experience they have, because even though, as I said, it's an incredible piece of equipment, it is much more sophisticated now, and they're pretty effective as far as hearing aids go. It is not perfect technology, right? And it's called a hearing aid for a reason. You cannot expect it to just restore your perfect hearing. If it was that, it would be called a hearing cure, which it isn't. So it is an aid, and like a walking aid, like your walker or a cane, it helps you walk, it helps you move around. It doesn't restore perfect use of your legs. If you have a problem with that, it doesn't restore it, but it does help you. So similarly, hearing aids do not restore your perfect, let's say, 20/20 hearing, right? It's no such thing, but it does not put your hearing, and it has its limitations. But if you have realistic expectations of what a hearing aid can do for you, it does help with all those health risks that I mentioned before, right? The risk of dementia, the high blood pressure, the risk of falling, mental health problems. Those things are all, again, scientifically proven to be helped with effective hearing loss treatment, so with hearing aids. But you have to be prepared and know what to expect for it to be effective. So first of all, you need to accept your hearing loss. And it is, it sounds very obvious, but for a lot of people, it is hard to accept because people associate hearing loss with aging, and nobody wants to be old or seem old to other people, right? And it is hard to come to terms that your hearing is not what it used to be sometimes. So accepting that is the first step in getting help and, helping yourself. So you need to know that communicating with hearing loss is more difficult, right? And people who do have a positive attitude, who understand that they need to get help, they do have better results than those who say, I don't have a problem. So another thing, like I said, it's important to have realistic expectations from the hearing aids. So one of the things is understanding that it doesn't restore perfect hearing. Another thing is hearing aids do not work from the drawer. So if you get hearing aids and put them in the drawer, they do nothing for you. And as we talked about, They are expensive, so it's an expensive piece of equipment. So if you do find a way to get them and then you don't use them, that's a waste of a lot of money. So sometimes people think hearing aids work like glasses. So you put them on and you can immediately see better. That's not how it works. Like I said before, we hear with our brain, not with our ears. So when your brain doesn't get that stimulation, when you don't get that audio signals, that audio information in your brain for a long period of time, your brain forgets how to interpret that. And it almost doesn't know exactly what to do with that. And it takes a little time for that brain function to be restored. So when you put the hearing aid in, what I compare it to my clients is physiotherapy. So it's not like glasses, it's like physiotherapy. Say you broke your leg and you were in a cast for 3 to 6 months. So your leg was not used. Once the cast is off, you can't walk on that leg like you used to before you broke it. So people need physiotherapy. And you go to physiotherapy, and after the first session, if your expectation is that you go in for an hour and you'll be able to run a marathon after that, you are probably going to be disappointed. And, you go to that first physiotherapy session, it hurts. After it, you're not feeling any better. And you say, oh, shag it, I'm not going to do that. Right? It doesn't help me at all. So it's the same with your hearing aid. So you get your hearing aid, you put it on, and you hear all those sounds that are really loud, really harsh. And it's almost like, not hearing is better than hearing all that noise, and your brain is overwhelmed and doesn't know what to do with all that. And you say, oh, shag it, I'm just going to put it in the drawer. And if somebody comes in, I'll put it in. But otherwise, I'm not going to wear it. But guess what? If you don't go to your physiotherapy week after week as it is prescribed to you, your leg is not probably going to get better, right? Every time you come to your physiotherapy session, it's the first session. So if you miss the months and you come again, it's your first physiotherapy session all over again. And it's just as unpleasant and doesn't seem to be doing much, right? If you're only doing it once a month. But if you go 3 times a week and you do those exercises at home, with time, your leg will get better and you can go and maybe even run that marathon. So same with hearing aids. If you wear your hearing aids every day, the whole day, eventually your brain will catch up and it will give you the full benefit the hearing aid can give you, right? But it doesn't work, as I said, from a drawer. So if you're only putting them in when company comes over and then take them off again, for your brain, it's the first physiotherapy session every time you put them in. So just think about it like this. And if you understand that sort of dynamic, maybe it will help you get the most benefit out of the hearing aid, because the first wear is not representative of what it's going to be like once you get used to it and your brain gets trained to hear those sounds again, right? And another thing you need to understand, the hearing aids are made for one-on-one communication in a quiet environment. So listening in noisy environments, in big groups of people and so on, is still going to be challenging, right? It is better, but it's not going to be perfect. So knowing those things, going into it with realistic expectations, is going to help you have success with hearing aids. And now, if you do decide to get hearing aids, it is helpful to research all options. There are all different types of hearing aids. They have different features, different sizes, and so on. So knowing your own listening needs and learning about different types of hearing aids is really, really important. And also what we tell all our clients, hearing aids have a 30-day money-back guarantee in this province by law. So no matter where you buy them, within 30 days, you are given that right to bring it back and say it's not working for me, and you'll get your full money back, because that's the law. And a lot of places offer longer than 30 days, which is good because it takes about 3 to 4 months for people to get used to hearing aids and to get the full benefit of them. So when you are getting hearing aids, ask how long of a period you have to return them if they don't work for you, right? So it gives you a little bit of a safety and security knowing that if you really don't like them, you can return them and get your money back, because it is a lot of money. And if you have any questions about hearing aids or anything about hearing, you can always reach out to us, and we do take our time and talk to you and find the best solution for you. So some other things you can do to help you is, of course, if you have hearing aids and other types of technology, use it, right? It's important to wear hearing aids consistently to get full benefits and to attend all your follow-up appointments. So your audiologist or your hearing aid specialist, they are trained to get the most benefit from your hearing aids for you. But you have to give them feedback and say, you know, this doesn't sound right, or I have difficulty in that situation. And a lot of the time that can be adjusted and helped, but you have to tell them. They don't know that without your input. So there are also other types of hearing assistive technology that can supplement and help you alongside your hearing aid. And I'll talk about it a little bit in a minute. But also you have to become your own advocate, right? You have to tell people, I have hearing loss and this is what helps me. Please face me when you're talking to me. You know, let me know you're talking to me, things like that. You have to educate people around you. A lot of the time people don't do it just because they're not aware of what they need to do. And most people are very happy to accommodate once they know what it is you need. So it is important to know your needs and to know what you need and tell others what it is, right? So don't be afraid to advocate for your needs. So I'll speak a little bit about hearing assistive technology, or HAT, as we call it at the office. And we talk about a lot of hats, and people think it's something that it's not. So hearing assistive technology is pretty much any type of technology that is not personal amplification technology. So it includes personal listening devices, TV listening systems, FM or DM systems, telephones and inline amplifiers, alerting devices, specialty products like, for example, amplified stethoscopes, captioning and transcribing apps. And I'll talk about a couple of those options that are the most requested and most asked about. So this is a pocket talker. And I call it a poor man's hearing aid, which is not very accurate description, but it gets the point across. So it is a personal listening device, and it's used to amplify sound and improve clarity of speech. So what it is that white little device with a microphone on top is connected to a pair of headphones or earbuds that a person would put on. And it's pretty much the microphone amplifies the sound and it goes directly to your ears into the headphones. And a pocket talker can be used for one-on-one or small group conversation. I'm sorry. So it is helpful for listening to your TV or the radio. And it has an extension cord, so the microphone can be extended to extend the range. So if you're far away from your TV, you can lay the microphone by the TV through the cord. It's not cordless technology, but it is very popular, especially with older people who have trouble adjusting to the hearing aids. So this is something that can be used in situations like talking to a doctor or like in a small group, or as I said, listening to TV and so on. And it's relatively inexpensive compared to a hearing aid. So this is something that is used a lot in nursing homes and places like this. So if you work with the public, it is useful to know what this is and how to use it. So if somebody shows up with this device, you would know it just needs to be turned on, and you can just lay the microphone on the table and talk normally, and it does a pretty good job at amplifying the sound. So if you or somebody you know is interested in this technology or any other type of technology that I mentioned, we have a big library of those devices in the office, and we do have a lending program which lets you borrow those devices for a period of time for free to try it out. So if you're thinking this might be a good idea for my father, right? But you don't know. So you can borrow it for a couple of weeks and see if it works for you and if it really does help. And then you would buy it knowing that it is something that is useful. So another thing is amplified telephones. We have a lot of those as well. And this is something that can help people with hearing loss stay connected to the loved ones, and, sometimes even do their job effectively, because, like a lot of jobs involve talking on the phone. So phones and inline amplifiers can help with that. So those are not just regular telephones. They are specialty equipment for people with hearing loss, and it has tone amplification as well as volume amplification, and it can be adjusted for different types of hearing loss and different levels. So it can be used with or without hearing aids, and there are different levels of amplification and different features and so on. So if this is something you're interested in, reach out to us as well, and we can talk about it. And another thing that is, I actually recommend everybody to know that feature. So in modern cell phones, this is included in the accessibility features actually, but you can also just download an app. And for Android devices, we recommend the Live Transcribe app. Unfortunately, it's not available for Apple devices, but Otter AI does the same kind of job, and it is available for Android and Apple devices. So what it is the app that offers transcription or closed captioning of live conversations. So you can pull the app on your phone and have everything people are saying around you transcribed on your phone, which means like closed captioning on your TV. Everything that's being said will come as text on your screen, and you can read it, which helps understand what is being said, right? So those are free apps, and they're available on any device nowadays. So that can be very helpful in understanding speech. And the last thing I'm going to mention is speech reading. So what is speech reading? People talk about lip reading and understand that better. And we kind of, probably all of us realize how much we rely on it during COVID pandemic, when everybody started wearing masks. We all realized, oh, I can't hear as well when people are wearing masks. And part of it is that the sound is blocked a little bit. But the big part of it is because we can't see the face of a person talking. And it does impede your understanding of language when you can't see the face. So lip reading is the term that means just reading the lips. And speech reading involves everything, including facial expressions, gesticulation, postures, body movement, and so on. So speech reading is a bigger term, but pretty much they mean the same thing. And we offer speech reading courses. Some people are really good at speech reading just naturally, and some people are not. So we do offer courses, classes in person as well as online. So in person, theoretically, we have 3 levels of speech reading available. We haven't offered level 2 and 3 in a while, But if you're interested and we have enough people registered, that will go ahead. And online course is called readourlips.ca. You can see the link right there on the screen. And you can do it just from the comfort of your own home. It is a great virtual program, and it coaches you in recognizing the most common speech movements. So it is a great program, and if you're interested, you should definitely register, and you can reach out to us again and ask us about it. So communication tips, that's the last thing I'm going to talk about. And that is something all of us can do, and not just with hearing loss, but of course, anybody with hearing loss will benefit from it. So the first thing is getting the person's attention before talking to them. That sounds very clear. Why would you talk to somebody if they don't know you're talking to them? But that happens all the time, like especially with your family. We would sometimes yell out from another room and get frustrated that we don't get the reply, but the person doesn't know we're talking to them. So they might just not be able to reply to you because they don't know to listen to you, especially if they have hearing loss. So it's a good idea to tell them you're talking to them before doing so. So making sure your face is clearly visible. Don't cover your mouth. Don't turn around. Don't, if you don't have to wear the mask, it helps if you don't. And if you do have to wear a mask, there are masks with clear windows that have the lips visible. So speech reading, as I mentioned, is very important in understanding what people are saying. Reducing or eliminating background noise. That is a big one. So if somebody doesn't have hearing loss, we sometimes are oblivious to how much that background noise affects people understanding speech, right? So we are really good at just filtering it out. But if you are talking to somebody with hearing loss or suspect somebody might have hearing loss, it is a good idea to close that window with the traffic noise outside, turn off that TV in the background, or turn off a fan if it goes really loudly, right? Or move away from, like, say, a noisy elevator and bring the conversation into another room that is quieter. Whatever you do, please don't shout or exaggerate your speech when you're speaking to somebody with hearing loss, right? Speak clearly and concisely, but shouting or yelling is really not helpful because the sounds that are hard to hear are not helped by yelling. So they're not any louder, and it distorts the facial expressions and makes speech even harder to understand. So shouting is not helpful. So if somebody doesn't understand you, repeat, rephrase, write it down, or use text-to-speech app. So rephrase is an important one. A lot of the time people get stuck in a loop. Somebody doesn't understand what they're saying, and they keep repeating the same words over and over and over again. But as we've seen with that unfair hearing test, right? Some words are just notoriously hard to hear. It doesn't matter how many times you repeat it. If the person didn't hear you the first time, the second time, they're not going to hear you the third time. So try and rephrase and say it a different way. Or if even that doesn't work, use some text to communicate, right? And use hearing assistive technology for yourself or others. So if the technology is available, like an FM system, please use it. We did have a human rights violation case at MUN where a professor refused to wear a hearing assistive technology for a student with hearing loss. And it is embarrassing in 21st century when people say, I'm not going to wear a microphone because I don't believe in it. Important thing to remember is to include the person in the conversation, right? Speak directly to them and not to their family, friends, or family members, friends or spouses. Even if they bring somebody for backup, it is important to talk to the person you're talking to and not to their companion. But also, as a person with hearing loss, you need to remember the communication is a two-way street, and you need to tell people, as I said before, what you need, right, from them to be effective in communication. So, and that brings me to the end of my presentation. Just a couple of takeaways that I want you to remember from this. Hearing loss can affect anybody and at any age, and it is not harmless. Hearing loss is invisible and hard to detect, but technology and effective communication can help. If you have hearing loss, it's a good idea to become informed and get treatment. If you know somebody else with hearing loss, it's important to support them. And most of all, remember that CHHA-NL, the Canadian Hard of Hearing Association, is here to help. So please reach out to us with any questions or concerns. And this is just a little overview of the programs and services that we offer. And this is our contact information. Thank you for listening.
Perfect. Thank you so much, Marta. I do see one question here in the chat as well. So it says, good presentation. So the hearing aid basically makes the signal stronger for the brain to understand. Am I right?
So the hearing aid is sophisticated technology. As I said, there are people with different levels of hearing loss, different types of hearing loss. You can hear well in high frequency, but not so well in middle frequency, and well again in low frequency. So it's very individual, and each hearing aid is programmed specifically for your hearing, and like for your specific ear. You can't even take like the left hearing aid and put it into the right ear and expect it to work well. So it is very, very sophisticated technology. It's not just like that pocket talker that I showed, right? That just is a microphone that goes, the sound goes directly to your ears. It just amplifies it. But hearing aid, it manipulates the sound and makes it as easy for your brain to digest as possible, right? So if you can't hear the high frequency sounds, it amplifies those without touching the low frequency sounds. So it is a very sophisticated piece of technology, right? So, and you can't like swap them around with your spouse or take somebody else's hearing aids and just put them in your ears and hear with them, because it is individually programmed. I hope that answers the question.
Perfect. Thank you. As you were talking, actually, a few more questions popped up, so I will just read them out. The next is the pocket talker useful for a person with a hearing aid?
So it can be, right? If the hearing aid does not provide enough amplification, sometimes the pocket talker can be used with a hearing aid. Now, it's mostly meant for people who don't wear hearing aids, but it can be helpful in some situations. As I said, if you're curious and you want to see what it does for you, you can always come to us and borrow it for a couple of weeks, free of charge, just to see what it does for you.
Perfect. Thank you. Let's see. The next one here. Children under the age of 10 have difficulty hearing fire alarms when sleeping. Is that correct?
I don't see a scientific reason for that, because actually children have a very acute hearing unless there is something, going on and they have diagnosed hearing loss. And they actually have better hearing in a high frequency than older people do. So it might be just because they're deep sleepers or something, and as a parent, you would definitely want to make sure if the fire alarm is going off, that a child is taken care of. You can't rely on them knowing what to do, but it's a good idea to have that conversation and to tell them what to expect and what the plan is if they do hear the fire alarm. But no, it's not true that they can't hear them.
Okay.
Not as far as I know.
Thank you. We do have another one as well. Are the text-to-speech apps free, the ones that you had mentioned?
Yep, the ones that I mentioned, and a lot of them. If you go into the App Store, whatever device you're using, and just type transcribing, it comes like there are a gazillion apps. That's why we kind of try to narrow it down, because there are so many, right? And actually, Live Transcribe is now included in accessibility features on Android devices by default. And Apple devices have their own accessibility features, but sometimes you have to be pretty, technology savvy to figure that out. So sometimes just downloading an app and knowing to just push one button, and comes up might be easier. So as I said, Live Transcribe and Otter AI is the ones that we use and recommend, but there are many, many more, and most of them are free. Yes.
Perfect. Okay. And then we do have one last question, and it's a kind of a more like personal question directly from Randy. And they said, it appeared that your phone rang during that presentation. Would a person with normal hearing have heard it because that person didn't hear it?
Oh, sorry. Yes, I think it wasn't. I am wearing earbuds, so I didn't realize it was my phone that was ringing.
And
Sorry.
I will say, Randy, I also didn't hear that. So I don't think there was any noise on our end from
Okay.
that. So if Randy was wondering about his own personal hearing, I didn't hear that either.
Yeah, I'm sorry about that.
Oh my goodness, no worries. I think that was just a question related to that
Yeah.
person's hearing as well. But no, I didn't hear
And
that one either.
that just tells you, right, that as I said, our hearing is very individual and it depends on the situation and the setting. So I guess my microphone in my earbuds did not pick up that sound. And even myself, I had trouble hearing it because I have earbuds in. So, I had temporary hearing loss.
Right, perfect. Yeah, so those are all the questions that I have here in the chat. But if anybody does have any questions that they didn't want to ask, like in the moment, and they want to ask you personally, I can always send out your contact information.
Absolutely.
And if there's no other questions, I just have a few housekeeping slides that I'm going to finish up with. And again, thank you, Marta, for that. So just give me one moment and I will bring up our last few slides here. Okay. Okay, so if you do need a certificate of completion for this presentation, you can just send me an email. So that's outreach@seniorsnl.ca, and I will send you one of those. If you're interested in being a friend of Seniors NL, so Friends of Seniors NL is an intergenerational opportunity to engage people of any age in the well-being and independence of older adults. Friends of Seniors NL will be given business cards to distribute to those they feel can benefit from Seniors NL information and referral services. And they will also have opportunities to attend any presentations or workshops that Seniors NL might have in their communities. Again, if there's any interest, that's my email there, outreach@seniorsnl, and we also have those numbers there as well. And then just really quickly, our next Let's Talk. So that's going to be on March 12th, and we have someone from the CRA coming to do CRA services and taxes and to talk a little bit about that with the upcoming tax season. And this is just our general information email, our number, and our website as well. But you can, again, always reach out to me at Outreach. And if there are any questions that are directly related to the presentation today that you didn't want to ask today and you want to send to me, I can always send you Marta's contact information as well. And let's see, I think I see one more question coming up. Oh, just a couple of thank yous. Excellent presentation. So thank you so much, Marta. And also thank you to Shelby and Jordan as well for your service today too. So if that is it for the questions today, we will go ahead and end it there. Perfect. Thank you so much, everybody.